Question: A 60-year-old woman presents with a sudden onset, severe, sharp pain in the right lower quadrant of her abdomen. She has a history of hypertension and hyperlipidemia. On examination, she has tenderness and guarding in the right lower quadrant. Laboratory tests reveal an elevated white blood cell count and a serum lipase level within the normal range. An abdominal CT scan shows thickening of the wall of the appendix with periappendiceal fat stranding. What is the most likely diagnosis? A. Acute appendicitis. B. Acute cholecystitis. C. Diverticulitis. D. Acute pancreatitis. The most likely diagnosis for this patient is A. Acute appendicitis. This patient's clinical presentation and diagnostic findings are consistent with acute appendicitis. Here's the rationale for choosing this diagnosis. Sudden onset right lower quadrant pain. The patient presents with sudden onset, severe, sharp pain in the right lower quadrant of the abdomen. This classic presentation is highly suggestive of acute appendicitis, as this is a common symptom associated with this condition. Tenderness and guarding. On examination, there is tenderness and guarding in the right lower quadrant. These findings are indicative of peritoneal irritation, which often occurs in cases of appendicitis when inflammation of the appendix irritates the abdominal lining. Elevated white blood cell count. Laboratory tests reveal an elevated white blood cell count. This is a nonspecific marker of inflammation or infection and is commonly elevated in cases of appendicitis due to the inflammatory process in the appendix. Normal serum lipase level. The fact that the patient's serum lipase level is within the normal range is significant because it helps rule out acute pancreatitis, option D, which often presents with severe abdominal pain and elevated lipase levels. Abdominal CT findings. The abdominal CT scan shows thickening of the wall of the appendix with periappendiceal fat stranding. This imaging finding is highly suggestive of acute appendicitis. Now, let's consider the other options. Acute cholecystitis. Option B. Acute cholecystitis typically presents with right upper quadrant pain, not in the right lower quadrant. It is often associated with gallstones and may cause fever, jaundice, and elevated liver enzymes, none of which are mentioned in this case. Diverticulitis. Option C. Diverticulitis usually presents with left lower quadrant abdominal pain, not in the right lower quadrant. It can be associated with fever and changes in bowel habits, which are not described here. In summary, based on the patient's clinical presentation, physical examination findings, laboratory tests, and CT scan results, the most likely diagnosis is acute appendicitis. This is a surgical emergency, and prompt evaluation and intervention are crucial to prevent complications such as appendiceal rupture and peritonitis.